Good morning to you from beautiful Denver, Colorado. My name is Erika Brown. I'm the CEO and the founder of the Paltown Development Foundation, which is the support organization under our model town called Town. That's right, you can smile. Town demonstrates our town model that through peer-to-peer communication, education, and support, helps those with colorectal cancer navigate their disease pathway. Every member of Town is a patient, survivor, and or caregiver for another with colorectal cancer. This is something that makes the experience and advice people receive in this conversation authentic, genuine, purposeful, and helpful. I myself was diagnosed with late-stage colorectal cancer 18 years ago. I'm one of the lucky ones. I survived. Not all do. When I was diagnosed, I was alone and had nowhere to turn. I had no other survivors to reach out and connect with to find out how they survived. That did make me feel alone. Colorectal cancer was a stigmatized disease when I was diagnosed. It wasn't a disease anyone talked about at cocktail parties or in public spaces. The loneliness that I felt then drove me to create Town to provide smiles and more conversation about the disease itself. And so also so that patients would not have to experience the loneliness that I had felt in making it down the pathway to survivorship. I've been very interested in artificial intelligence and its benefits for some time, and believe, if done correctly, it can really help diagnose diseases that one wouldn't otherwise be even caught, 2, reduce unnecessary scans, and 3, do much to eliminate health disparities. 1, from my perspective, AI can be an incredibly helpful tool for patients. AI can help the radiologist better identify and diagnose what may turn out to be disease on a scan. I've known too many people who were imaged, told their scan was clean, meaning no progression, only for them to find out later that indeed their disease had actually progressed because an AI effort had spotted something that the human eye could not see. So identifying potential issues that may not have been recognized by that human eye of the radiologist can be life-saving for me, for you, for us, the patients. 2, another aspect where AI can be useful, in my view, is ensuring that imaging and other diagnostics aren't needlessly repeated. Since AI can help the radiologists and other physicians in following clinical guidelines when a lesion is seen on a scan, AI can reduce those unnecessary and inappropriate imaging sessions. Yeah, they can. This means a patient can avoid care that not only doesn't help, but will also help avoid the costs to both the patients and the providers and payers. Reducing costs, a real element here. 3, I'm also very concerned about how healthcare disparities disproportionately impact people of color. We see this all the time in our colorectal cancer community. Disease and therapies impacting people differently. Unfortunately, whether it's for clinical trials or for clinical guidelines, care pathways aren't designed with diversity in mind. So therapy for an older white male may not be as effective as a therapy for a younger Black female. I hope that AI can be used to help shrink and one day eliminate disparate care and help to ensure that all people receive evidence-based care that is tailored to their specific situation. I personally think, as a patient, that the FDA has done a great job in getting safe and effective AI modalities into use. As a patient, I encourage the agency to continue to focus on how AI can be built to help identify diseases that could be missed, drive better use of imaging, and eliminate care gaps based on gender, race, and/or socioeconomic situations. Thank you very much for your time, your attention, your good ear to hear the patient voice on this matter of artificial intelligence. So important for the future of healthcare, something we all care so much about. Thank you again from Denver, Colorado.